Good evening, everyone. I would like to thank all of you for coming today to attend our lecture about osteopathy, filling the gap in medicine. I'm Basma Shem, one of the first graduated group from the International Academy of Osteopathy in its Egyptian branch here in Cairo. And it's also represented in the Middle East and in North Africa by Professor Dr. Our speaker today, Dr. Hesham Khalil. Just before our lecture, I would like to tell you a small story about an American physician who was working in the U.S. Armed Forces, and he was a great physician in this era. About nearly in 1976, 150 years ago. Actually, this physician was working in the Armed Forces, and he lost three of his children. Guess what? By epidemic flu. Although he was a great physician. This shock was really miserable for him, and it guided him to discover and search a lot in order to find a new way of thinking in order to help patients. So we are here today to know more about this new philosophy and this new way of thinking in order to help patients in our clinics and in our society. I hope all of you will enjoy our lecture and get a new knowledge about our way of thinking. So welcome with me, please, Professor Dr. Hashem Khalil, our speaker today. Thank you.
Hello, everybody. Thank you, Dr. Basma. Thanks for the Sawi Culture Wheel to the invitation to talk about osteopathic medicine and how osteopathy works. Thanks for everybody supported the event. And in particular, Mr. Mahmoud Sawi and Mohandes Sawi. Muhammad Sawi and Madame Iman for organizing organizing the event. Okay, osteopathy fills the gap in medicine. That's today's title, and let's start with introducing myself. My name is Hesham Khalil. I am the representative for the International Academy of Osteopathy for North Africa and Middle East. The International Academy of Osteopathy have almost 27 branch, most of it in Europe. The Cairo branch is number 27, branch number 27. And it's presented here in Middle East and North Africa by Osteo Egypt. This is who's Hesham Khalil. I have actually a story to tell. I'm not going to talk about my credential, actually. I will talk about the most affected part in, like, let's say, eye-opening, or let's say a tragic story. You can call it whatever you want. I was one of those lucky people who graduated from Cairo University, Faculty of Physiotherapy in 1985. And I was quite lucky that I started my career shortly after graduation in the States. I was lucky get the board first time. But I was not lucky going through some car accident, actually I got like 5 total loss car accident, where it results in what we call it in medicine cholesterol headache. Cholesterol headache, it is some kind of headache which is unable the person to talk, to see, to hear. It's like totally disabling headache. Where I looked for, or when you live in Chicago, you have the best access for the best medical care worldwide, like Northwestern Memorial Hospital. I went through most of the highest class medical care, and sadly, all of those models or all those physicians agreed on one thing, like that I have no problem. I do have no reason to have that pain, and it's only in my mind. Can you imagine if you are in your 30s, like just started your life, and you're totally disabled by pain or headache? And the worst of it, that all physician, all doctor inform you you have no good reason to have this pain, which is terrible. I think this is one big mistake we usually, as the doctor, do to our patient. We don't really necessarily know everything about the patient, because we have a very complex, patient have, let's say, several aspects: physical aspect, emotional aspect, let's say spiritual aspect, and pain is a perception at the end of the day. But physician usually looking for a physical evidence for the pain. So if you're having back pain, the doctor usually looking for disc protrusion, looking for strained muscle, looking for fracture, looking for tumor, inflammation. Always the doctor looking for some kind of physical evidence so they can treat. But in medicine, recently we discovered that we don't know everything about, we cannot discover everything in the patient, because there is a lot of things we cannot see by the most advanced MRI or CT scan or the best advanced computerized imaging, for the very simple fact that human body is so fine. Sometimes the changes, the small changes within our body can create a lot of pain, but cannot be proven physically, or we cannot actually see it, but the patient actually feel the pain. When someone is in pain, the worst thing you can tell them, it's only in your head. So you make them more, you make them actually feeling more pain, because they start thinking that they are crazy, they're having a psychological problem, and so forth. So one of my, I think the best credential I do have is suffering from pain. So that's my story. So where I decided to try something else from different kind of model of medicine, which is only available at this time, and up to my knowledge at this time, to try to be treated by osteopathic medicine. And after 5 years of suffering and totally disabled, cannot work, cannot communicate with the family or communicate with the co-worker or even with my friends, I decided to go and to try something else. Like when you are in pain, you are totally desperate. You can try anything, even if you don't actually believe in it, but the pain will make you think to try anything. So I treated by an osteopath after 5 years of suffering, taken 4 medication. One of those medication is a narcotic, and it was not even efficient to treat the pain. I went to be treated by an osteopath. Then within 3 times, in a period of 3 months, I was totally normal. So I realized this is a clear message from God to change career. At this time, I'm very well-established physiotherapist in Chicago, and I had like 5 clinics in northeast Indiana, and Chicago is like nearby state. But the main shock then was that I didn't know anything about osteopathy, and I have no clue there is a way of treating patient with a different model of thinking. So I decided to go ahead and change careers. So I went to the Canadian School of Osteopathy, which is a 5 years program, actually 7 years, but because I was a physiotherapist, so you don't have to go through all the full-time education. By the end of my schooling, like when I was in the 4th year, I realized that I was used to come to visit my family here in Cairo, and I realized the market gap and the need of the people, especially poor people, for something like osteopathy. Because when you come from the States, the first thing your family will ask you, okay, do you have a medication? Can you treat me? Can you help me with my neck pain, my back pain? And in osteopathy, the treatment is quite simple because we use our hands most of the time, and we use a lot less medication. And we'll talk exactly about what is osteopathy, because we have several models of osteopathy worldwide. According to the American model, osteopathy is a system of medicine based on the theory that the disturbances in the musculoskeletal system affects bodily parts, causing many disorders that can be corrected by various manipulative techniques in conjunction with conventional medical, surgical, pharmacological, and the other therapeutic procedures. So osteopathy is a model of medicine. So it's not a technique, it's not a paramedical, it's not a physiotherapy, it's not a chiropractor, it is not a massage, it's a medical system totally independent by itself. And it's based on the theory that musculoskeletal system as an integral part of the body, and any problem with the musculoskeletal system or neuromusculoskeletal system, any disturbance in the musculoskeletal system will affect other bodily parts. Like what? Let's take a small example, like if somebody have, let's say, you choose. What do you think if we make it today like interactive? Can you suggest any musculoskeletal problem? Anybody would suggest musculoskeletal problem like what? Round back. Very good. And you would suggest something? Knee pain. Okay, we'll do both. Neck pain. Very good. So let's think of round back or bad posture. Okay, so that's musculoskeletal problem. So it's not actually a disease. So it's a dysfunction or inability to be erected. That means some weakness of the back muscles, maybe some problem with the neck, maybe some problem with the spine. Okay, how this may affect other bodily parts? Let's think more anatomical model. Think of the chest cavity. What's inside the chest cavity? We have the lungs, we have the pericardium, we have the heart, big vessels. Then right below that we have the diaphragm, and just below the diaphragm we have the liver, spleen, and many, many abdominal organs. So when you do this, how is this going to affect the organs? It definitely will affect the organ. It's definitely will squeeze the liver. It's definitely going to make you unable to take a good deep breath. That means your oxygenation rate will be changed. So if you keep going like this for months and years, that eventually will affect your general health. So that's one simple thing. But this is actually, it's not a disease or dysfunction. This is just a habitual thing. Like it's not, we do not consider this as a musculoskeletal issue. But let's say neck pain. You choose neck pain or knee pain. Think of me having, let's make it simple. Let's think about right knee. And I will give actually that example later. If I walk with a knee pain, how am I going to be walking? You think I'm going to be walking straight and upright, or going to be limping? Good. I need to, from you today, to use your imagination a little bit. Think of the pelvis as even level. And because the brain, when we have a pain anywhere in our body, our brain gets informed, so the body will create some kind of adaptation, or we call it compensation if you wish. Means the body will order the muscles to put less weight on that painful part. So what's going to happen? I would be walking most probably like this. All right? What happens if I keep walking like this for about 3, 4, 5 weeks? What's going to happen to my back muscles? What's going to happen to my spine? What's going to happen to the rest of my body? You see what I mean? So we call this compensation. So your body starts to compensate like anything else. Eventually, you will create what we call it pelvic torsion. Pelvic torsion in a very simple way, because we are 3D, so it's not like your like pelvis will be like this. It's more like that. It's more like torsion means that part of your hips will be a little bit forward. The other one will be a little bit backward. Well, I would like you to think about the organs inside your pelvis, especially if you're talking about a woman. We have ovaries, we have uterus, we have colon, we have bladder, we have part of the rectum. So when the pelvis becomes torsioned or twisted, that will create torsion or twist or pressure on the internal organs, pelvic organ. So if this happens for a week or so, no big deal. But if it happens for months and years, that's a problem. The situation changes from somebody with teenager to young adult or children or women or men in 40s or geriatric patients. So the situation here that is going to, the older we get, the less flexible we are. The tissue becomes less flexible, so the compensation becomes tougher in the body. So the body starts to ache. Sometimes patient comes and say, we ask them usually, did you ever fall, car accident, sports injury, whatever? And they don't really get this question because they think that we're asking them about something happened last week or last 6 months. We usually ask for, did you ever fall? Did you ever have a car accident? And most of actually patients do not connect. But guess what? When we are young, our body is quite well, we are active, it's flexible, so we don't feel anything because body able to adapt. What happens when we get older? Our muscles, joints, capsules becomes drier. So the body comes to a point where it can no longer adapt or compensate. That becomes failure of structure. I'm not talking about organ failure. Don't be scared. I'm talking about the inability of our body to handle a stress of some kind due to mechanical dysfunction. So that's one example. Like think of neck pain, for example, or let's talk about back pain, make it more simple, or we can talk actually about both. What about somebody with neck pain? How the neck pain may affect our posture or behavior. Do you ever see somebody with the neck pain walking like this? Can you describe somebody with neck pain? Can somebody tells me? I'm sorry? Lower back pain, okay. Same thing. Pain in general, it's perception. So let's think about, okay, I think it's important to talk about back pain because back pain will make it maybe better to understand. Pain is not a disease. Pain is a symptom. So the pain can come from the bone, can come from disc, can come from muscles, weak muscles, can come from spasm muscle, can come from the kidney, can come from the colon, can come from anywhere in the body, or at least from, we call it digestive system or abdominal organs. So imagine, I'm going to tell you a true story here. You go without actually experience any fall or accident or anything, but with current, let's call it chronic pain for last 6 months or last year. You get up in the morning with a stiff back. It takes a little time to loosen up. It starts to affect your way of living, your lifestyle, your activity level, the way you do things in life. You decided to go to the doctor. Doctor will tell you, okay, please do MRI or CT, or actually first time you go to the doctor without significant problem, we'll give you some muscle relaxant, anti-inflammatory. Maybe if you're nice and good, we'll send you to a good physiotherapist. Then what? It's not working. It gets worse. When I go to therapy, it makes me feel more, I feel more pain. And it's not working, doc. So the next step doctor will do, will send you for imaging, MRI, CT, whatever. Oh, oops, you have protruded disc between L4 and L5. How good is that? Did he discover something good or important? Guess what? It's not important. 53% of population have some kind of discogenic problem and totally asymptomatic, like they don't have any pain. But the doctor loves this because it's a good reason to send you to a surgeon. It changes from ethical, I'm not saying this has happened with every single doctor, by the way. Or maybe he need to upgrade you with a medication. What is the difference about osteopathy looking at this patient? What is the true difference? That we do not treat pain. We treat patient with problem. So the first thing an osteopathic doctor or osteopath or physician looking for this patient, we need to put our hand on the source of pain. And as I mentioned, pain can come from many places. It can come from bad, you have to be a good doctor to know where it comes from. Like we usually ask patient, especially a female, it has anything to do with the period or menstrual, menopausal stage, or have sports injuries in the past, or whatever. Then we have to go through a series of tests and investigation. It's called physical examination, to figure out the first time our main goal to find out where is what we call it primary lesion. Primary lesion can be an ovarian cyst. Wow. Ovarian cyst, chronic ovarian cyst can create low back pain? Yes. What about the discs? Yes, but in order, that's what is different about osteopathy. We do not rely only on imaging. We rely on our palpatory skills. We touch our patient. We try to figure out where is the problem exactly. Okay, so if it's not the ovarian, let's see what's wrong. If she had a cesarean section in the past, fast delivery. By the way, my patient usually ask me, what about fast delivery? What fast delivery can affect me? Can somebody tells me? Okay. What's wrong with C-section? Everybody do C-section now. Even normal total female they still go to do the C-section because it's easy, or she's been advised by her doctor to do the C-section. Okay, let's think back to the definition, musculoskeletal disturbance. What happens when you have a C-section on the lower part of the woman's abdomen? Does it affect, you think it does affect the center of gravity? Because in reality, when you have a C-section in this area, as if you pull my belt down, what happened to your back? Your back will be more lordotic or curved, where center of gravity, the one God created by, which is the best thing, which would give you the better biomechanical balance for your body, that changes. What about if you do the second C-section? What about if you do the third C-section? How is this, you think, will affect the mechanic? Okay, researchers tell us that most of the women, let's say, good percentage, maybe 60% of those who do more than 3 C-section will complain or will damage part of the L5, L4, L5. We call it spondylolisthesis, like the lumbar spine number 4 start to slip because of the pulling forward over the 5th vertebra. So when you treat this patient, and this is have many grades, it's a long story to talk about it. It's a surgical if it goes beyond 2nd degree, like half of the vertebra slipped over the lower one. Okay, so what about if we catch this patient quite early, when she starts not even the first grade of spondylolisthesis? Where and how we're going to treat this patient? Shall we treat her with physiotherapy or shall we give her medication? What do you think? Or maybe we should think a little bit out of the box and try to release some of the tension in the scar. That's if it's possible, because scar is a big story. It can be very light and can be manipulated and released by hand or like some kind of manipulation, and can be structured, like no way you can do anything with it. So if we catch the patient early enough to create or release this kind of mechanical imbalance happen to the musculoskeletal system, so this is the way you're going to treat this patient in this condition. So can this patient have other issue on the top of this C-section? Like, for example, she used to play tennis when she was young, and she had a couple of injuries in her back. Can we treat everything together, or you have to find the primary cause of every single lesion this patient had? So this is the osteopathic thinking. But in order to make it more simple, we came up with 4 principles. Principle of osteopathy. Okay, osteopathy now relates or theorize or concept the system of medicine based on the theory that musculoskeletal system, if they get disturbed, will create damage or problem or dysfunction in other places like organs. Okay, how does this work in reality? So this is the principle. The osteopath think that the human body is one functional unit. Mind, body, and spirit are interconnected. That's number 1. Number 2, form and function are interdependent. What's mean by form? Form means anatomy. Okay? Function means physiology. So always in osteopathy, we look for the relationship between the patient's anatomy and patient physiology. Like, we don't take actually one side. Like, let's give a simple example. If somebody having a muscle spasm, what's going to happen to the function of that muscle? Or let's make it even more simple. Muscle spasm will squeeze the arterial and venous system. So muscle spasm can create what's called ischemia or congestion. It depends on what the muscle spasm compressing on. So if the muscle spasm, let's say about calf muscle, so it will affect both actually, because the calf muscle have like arteries and veins going through. So you may have swelling in your leg because of the muscle spasm. Or you may have ischemic effect, like more pain, if you have a muscle spasm. Okay, think the other way. Think of if somebody have a problem with the blood flow, what's going to happen to the muscle? Do you think the muscle will function well? Same story. So this is the principle. This is the second principle. Third principle, that the human body has the innate ability to heal itself. In other words, God created us with self-heal, self-repair, self-adjust model, like automated. If you go through a bunch of people with the flu, most likely you're not getting the flu because you have a good immunity. But if you get your cut your hand or something, it will heal by itself. So we are created originally with the ability to heal ourselves, self-heal, self-repair, self-adjust. If I fall and twisted my ankle or twisted, most likely if it's not that bad, as soon as it heals, everything goes back into place. So what happened? Why we're not healing or heal ourselves all the time? This is number one answer and number 100,000 answers. And the only answer, let's call it homeostasis. The word homeostasis, that is what we call it the ultimate biomechanical balance of the body. Let's give you a better example. Let's talk about biochemical balance. What's wrong with the diabetic patient? Why they are not healed well or healed quickly? What's wrong with them? Anybody can tell me? What's wrong with the sugar? So they are biochemically not balanced. God created us with a blood of pH neutral, like not really neutral, it's 7.2. Like it's not alkaline, it's not acidic. But if your body blood becomes more alkaline, what happens? What alkaline means? Irritation, infection, inability to heal. That doesn't mean like too much alkaline is good. I'm talking about acidic. Excuse me, I mean acidic blood is bad. Acidic blood enhances inflammation and infection. What about if your immunity system, your lymphatic system is not flowing well? You're going to get infection. You see what I mean? What about if your spine and your mechanic is not well? That's a musculoskeletal disturbance which will going to affect the other bodily part. So the main three principles here, that the body is one functional unit, and this is how we see it in osteopathy. So when we have a patient with knee pain, we evaluate them from head to toe, inside out, including past history, family histories, everything. Because why we do that? Not because we have time on our hand, because we see patient as one functional unit. If something bad happened to the hip, it will affect the whole body. If you're having bad knee, for example, what happens when you have a flu? Only your knee aches or all your body aches? All your body aches because your immunity system challenged the infection and so forth. Second principle, anatomy and physiology. Third principle, God created us with self-heal, self-repair, self-adjustment. Fourth principle, that the above osteopathic manipulative treatment, the treatment we provide, which is most of it manipulative medicine, like we move the patient, based on the upper three. So it's like, let's call it in a simple way, customized treatment. There is no, in osteopathy, we don't have the luxury of saying treatment of low back pain. Like I've been asked a lot. When I do short speech in conferences, okay, what is the osteopathic treatment for stroke patient? Huh? There's no such thing. Okay, what is the treatment for low back pain? We don't treat pain. We treat this function. Do we treat patient with anatomical, physiological problem by the musculoskeletal system? So we are the mechanic of the human body, and so forth. Okay, let's move on. Low battery, my friend, Shabab. Low battery on the. Language, from language point of view, osteopathy comes from two parts. Osteo, which refer to structure, a structure of anything. It can be tissue, muscle tissue, nerve tissue, brain tissue, vascular tissue, whatever tissue, bone tissue, that's considered, okay, all right, that's fine. I still remember everything with the lecture, so don't worry. Pathos means suffering. So osteopathy literally means removing the suffering or stress from the tissue. That's if you're talking about literally the like word by word. So in reality, osteopathy means removing the suffering from the anatomy or physiology so they integrate. You see where I'm coming from? So that's a word. Well, so how this work? Okay, let's talk about first the guy came up with the idea, as Dr. Basma mentioned earlier. His name is Dr. Still, Andrew Taylor Still, born in Missouri, and actually came up with the idea after death of his 3 children with typhoid or meningitis. We don't have a clear objective documentation how they died. But he came up with the idea that, of course, Dr. Still was at the era of 1874. We're talking about before the penicillin, the antibiotic, the luxury of the medicine we have today. So Dr. Still start to think about other way of treating patients. So he decided, he questioned himself or his credential of being a doctor. By the way, Dr. Still was a priest and military physician. So think of yourself as a priest and military physician or sheikh or whatever, and you lose 3 of your children, you must think that God doesn't like you. He didn't thought that way. He thought like, this is a test I have to go through. And he was a very good man. He decided to look into causes. Why children dies for typhoid or meningitis, and he's totally was unable to treat them or even help them to survive. So he started to go to the graveyards, pick those bodies, try to rework in the anatomy again, like he do dissection on them, until he, after a long time, thank you, he came up with, he started to work on, he came up with the part of the human body called the autonomic nervous system, or God created us with something very unique, which is called autonomic nervous system. What's autonomic nervous system? What happened when you are angry? What happened to your blood pressure? What happened to your muscle tone? What happened to your breathing? What happened to your mood? Sympathetic and autonomic nervous system, it's about regulating or adapting the environment or adapting yourself. What happened when you have a hot weather? What happens? You sweat. What happens if you're angry? Your blood pressure increases, your respiration rate increases, your pulse increases, your muscle becomes more strong and toned. What happens if you go into the bathroom in the morning? Totally opposite. You have to be relaxed, everything cools, everything, so you are able to go through the defecation process. Okay, so this autoregulation system, it's part of the central nervous system function, which regulates the human body in environment and in action and behavior. So the sympathetic, Andrew Taylor Still discovered that there is something going near to the spine, and he treated a lot of children with chest problem or infection through manipulating their spine, aiming to inhibit the sympathetic system. So he was successful. So he wrote a book on how to treat child to improve, with typhoid or with infection through manipulating their spine. You see where I'm coming from? So he came from that point. By 1900, he started the first school of osteopathy in Missouri, Kirksville, Missouri. Then after that, osteopathy moved to Chicago, 1918. Then moves to England by Little John. Then moves to the rest of the world except our area. Don't ask me why. I have no clue. Until 10 years ago. Oh. All right. That's Andrew Tiller's tale. 1900, did the American Osteopathic Association, and died by 1917. Today, there is 35 osteopathic medical schools in the States by itself, and they consider it the fastest growing medical model in the world. There is 17 in Russia, more than 100 plus schools in Europe, many, and one have here in Middle East. This is supposed to be a video, but unfortunately the sound is not working, so this is how the American look into the osteopathy. Because it becomes the fast-growing medical model in the world, so they decided to adapt that model and actually promote it to physician and other models to push it more. There is two model of physician in the States, MD and DOs, and both have the same rights in 50 states. Sadly, we don't have the sound on, so I'll let it go faster. Okay, osteopathy treats more than you think. Okay. Like how osteopathy can treat headache, muscle tension, neck pain, kids. Okay, that's the challenge here. Let's go back to the definition. System of medicine, musculoskeletal disturbance affect other bodily parts. The way is can be corrected by so and so. Let's get let's get more in depth. According to the osteopathic model, we have 4 or 5 stages of health. That will make things more easy. Okay, remember, I don't know if most of you know or not, we have something called sacrum. This is like the base of the spine, and the last part of the pelvis, like a part of the pelvis actually. And when we walk, the sacrum adapt the weight bearing. So every time I'm walking, the sacrum moves. So there is what you call it sacroiliac joint. Sometimes you get some pain one side of your back, and you go to the doctor. The doctor will tell you have a sacroiliac pain. What that means that your sacroiliac joint has been affected or is not moving as should be. Good. What happened? So normally the sacroiliac joint moves every single time we do steps. So my sacroiliac moving that way, so now it's moving that way, so it's always moving. Okay, think of I slept on the steps and my right sacroiliac becomes inflamed. How I'm going to be walking now? The same? It's not the same. I'll be limping. Good. We call that, when we have less function, we call it compensation. So the first thing is called adaptation. Like this is a stage of normal health. Like my body is adapting the pressure. Okay. So if my right sacroiliac is no longer able to take the pressure, we call it compensation. So in the compensation stage, the body began to absorb. Look at this word, absorb. Absorb restriction, adaptation is reduced. Your body no longer able to adapt. Therefore, presence of loss of mobility or vitality. Don't worry about that word. So my right sacroiliac is no longer able to do full weight bearing. Okay. What happens after that if I keep ignoring the pain or keep taking pain medication for nothing? Okay, I go to what's called lesion or osteopathic lesion. So it's a full loss of function on the right sacroiliac. How I'm going to be walking now? More like this. So I'm no longer limping. Because limping, so I have some function. But when you have loss of function, so in this stage, characterized by body inability to further compensate. So my body is no longer able to compensate. So that's called function problem. So what about if I keep ignoring this and do the wrong thing and go to the gym? The joint becomes to be inflamed, then called arthritis or whatever you call it. So this is the beginning of the pathology within the tissue. We call that decompensation. Then after that, the tissue will be going to death. Okay, so in osteopathy, do you treat everything? Of course not. In osteopathy, we have two models of treatment. We call it curative model, and if you come in these stages, we can cure you. This is called curative. We can fix you. But if you come in the decompensation stage with a lot of arthritis, our role becomes rehabilitative. So we'll help you, but not exactly, not curing. Well, we'll take example of knee pain. Knee pain can be infection, inflammation, tumor, trauma, genetics, psychological, somatic dysfunction, or can be more specific, patellofemoral syndrome. This is like a specific structure when you have a specific issues in a specific structure, like meniscal tear, like anterior cruciate ligament, like capsulitis or synovitis or a patellar tendon. So we can think of a knee pain as global category, like basic categories like infection, inflammation, tumor, trauma, and so on. So, or go specific on this. Well, is that enough? No, it's not enough for us. It's not enough in osteopathy. Why is not enough? Okay. In osteopathy, we have to analyze patient from three perspectives, from biomechanical, fluid, and neurological. Let's think about it in depth. What means by biomechanical? The most important question when you think about somebody with knee pain, let's go backward again. Let's pick patellar bursitis, or there is something happened to young children called asgochatter. Asgochatter, this is inflammation of the tendon between the patella or the kneecap and the tibia, that little part, this here. If you open a medical book, the treatment is rest, because the kid cannot walk, cannot do sports. Sometimes not even rest only. You can put cold bags, you can give anti-inflammatory, but nobody think why this kid would have asgochatter. In osteopathy, we do. Because we have to look at this patient from biomechanical point of view. We have to analyze the line of forces going through the knee. Most of the time, when you see asgochatter patient, usually it's teenager, and it usually fall or have a heavy sports, like they play American football or anything. So usually fall. Then when they fall, they torture or they twist their pelvis. So the weight bearing going on through their knee is no longer in place, and that creates some kind of friction to the ligament, or let's call it the tendon. the tendon. So if a kid had a fall, strong fall, and he becomes twisted like this, the line of force going from the spine to the pelvis, to the hips, through the knee, going to the ankle is no longer in place. And that line of force, if it goes a little bit anterior, a little bit posterior where it should be, it creates problem. And that's what it creates. Creates inflammation to the tendon, to the capsule, to the bursa. So the way of thinking, that's different. So how we treat this patient, we treat the cause. So we don't give them rest, nor giving cold compresses. We fix their pelvis so they can mechanically be restored, so they heal themselves. You see the point where I'm coming from? The second thing is fluid flow. Okay, think of, when I'm talking about fluid flow here, it means not only blood flow, like lymphatic or what we call it, venous flow. We're talking about lymphatic flow. We're talking about fluid like CSF flow. We're talking about the like the tissue within the tissue fluid itself. So let's go back to anatomy and physiology of a structure. If the structure doesn't have enough blood flow and enough blood drainage and enough lymphatic, it will be dysfunction. You see where I'm coming from? So it's quite important. Let's go back to the knee problem. Okay, what about if this patient get swelling in the knee due to torsion in the back of the knee, like Baker cyst? Do you remember what I'm talking? It's like a swelling comes in the back of the knee and usually restrict the highway of the blood flow in the back of the knee, because in the back of the knee there is a lot of arterial arteries and vein and lymphatic in this area. So if you get something to block this flow, this can create knee pain. So knee pain can be what is this or that, but that's not enough information to treat the patient. You need to know why he has this particular problem through those three perspectives. Patient needs to be evaluated biomechanically, fluid flow, and neurological. In the States, I used to work in a big rehab center, and we used to see a lot of patient with total knee replacement, total hip replacement, and so forth. And one of the nightmares we used to have is called sympathetic dystrophy, or like normally patient with total knee replacement, they can bend their knee to 90 degrees within a week with therapy, with good therapy, of course. What about in those patients? They come to us with a lot of swelling in the knee, painful like hell, and red, hot, everything wrong in this knee. The first impression to the doctor comes, oh my goodness, this is infection. It's not infection. It is a reaction from the sympathetic in the back, creating swelling, hotness, redness in the knee. And that create a problem with getting back to the knee range of motion. So it's a nightmare for patient, for therapist, for doctor, for those patients have total knee replacement and they have sympathetic dystrophy syndrome in their knee. So how we see them in osteopathy? In physiotherapy, we used to say, no pain, no gain. And I loved it then, because you can torture your patient. That's no good. In osteopathy, you have to think about the primary cause. And actually, that's its name, sympathetic dystrophy. How are you going to treat the knee pain if it comes as a sympathetic dystrophy? You treat it from the back, from the source of the sympathetic root or sympathetic ganglia supplies the knee joint, and so forth. So without those three components, you cannot do it in osteopathy. Osteopathy have several branches within the model, like musculoskeletal model, cranial model, and a lot of like big subspecialty for children and infant babies, like babies. Let's give more visual so you can think about it in a different direction. When we treat the spine, when somebody having a spinal dysfunction, we cannot see the spine, we cannot just see this patient as just a spine. We better see the patient as a human with a spine, not just a spine. Because if you think of your patient just a spine, you can do anything you want. You can bend them, you can pull them, you can press them, you can do anything you want. But when you start think osteopathic, like structural function relationship, and self-heal, self-repair, self-adjust, and one functional unit, you better think that way, that the spine have attachment and muscles. The spine connect with other things, lower extremities, upper extremities, trunk, and in those limbs there is what's called fascial system, like that little stuff you see when you eat meat or even cleaning chicken, that white stuff usually between the skin and the meat. That's called fascia. And I don't want to go medical here. We have to see this patient also as a vascular system connected to the spine. So it's a human with a spine connected with other things and organs like vascular system, like neural system, like attachment. This is the view of the diaphragm. I know this is going to look strange to you, but if you cut somebody like this and look this way, this is what you're going to see. This is the diaphragm from below. Okay, if somebody's like lying down, I'm looking this way. Okay, diaphragm is a muscle, right? What happens if your muscle becomes spasmed? What's going to happen? What happened? You get shortness of breath. What else? You have to think osteopathic here. Where it attaches in the spine, it attaches to the cage, the ribs. What else? What structure goes through the diaphragm? We have big three opening, large opening, like the aorta, which is the main blood to everything below the diaphragm. And the aorta is called abdominal aorta. It gives abdominal viscera, organs. It gives everything down. Okay. Also, it has vena cava going up. That's through the liver. And we have esophagus going down. Think for a minute how those three major openings may be affected due to the spasm. Everything go crazy. The blood flow going up will be restricted because it goes through the liver. And the liver attaches the diaphragm directly, like we call it the bear area. Like actually there is no space between good part of the liver and the diaphragm. And the vena cava, which collects blood, venous blood from both lower extremity, abdomen, and all organ to go through the chest and then goes to the heart, will be impeded or restricted. That create swelling in the lower extremity, create congestion in the abdomen, create liver congestion. That's one single structure has been affected by the spasm. What about the aorta? It's going to be affected, but not as much because the pressure is quite high and is going down. What about the esophagus? Think. You hear about hiatal hernia, you hear about pain, you hear about mid-dorsal pain. There is something called cardia. Cardia, this is like a little valve or sphincter between the esophagus and the stomach. Okay? And that have direct innervation to the back. So patient come with mid-dorsal pain, not because they have injury or they fall or had accident, because their cardia is spasm. You see where I'm coming from? You see the connection now, how it works? So in osteopathy, it's not enough to give a diagnosis. It's important to know why this patient having this problem that day in particular. Speaking of spine, we still look at spine from osteopathic point of view. This is a spine. This is a cross section or cut, longitudinal cut in a human. You see this is a heart, big vessels, spine, and the other structure. Okay, when we treat the spine, we need to know that, for example, the heart have attachment to the spine, to the sternum, to the diaphragm. What about if somebody get a rheumatic fever? Everything would be contracted because of the inflammation. Is this may affect the spine? Absolutely. People with bypass, when they replace some of the vessels or they brace valve replacement or whatever, what happens to the pericardium? Pericardium becomes tight. I'm not sure if you know or not, they wire them. They don't really, actually, the sternum becomes like the suture inside, but outside it's wire. So because this is a strong muscles. How this will affect the spine mechanically? Definitely will. God created important organ protected. Like look here, kidneys, consider in the cage, down, liver, spleen, stomach, lungs, heart, brachial tree, all protected by the cage. Where is the cage connected? How the cage is suspended? Through the spine. So if you get any spinal dysfunction in this territory, it's directly or indirectly will affect the organs. That's why it's not enough to hear about somebody with back pain. You need to know where the pain comes from and you need to treat it. Okay, think of this picture little in depth. Think of somebody with a bad fall, but no bad fall. Like most of the women here during pregnancy, they slip on the steps. What happened? What happened to those structures? Think about it. It would be affected some way or other. I'm sorry? Okay. Think of the neural system. Think of we have what's called sympathetic and parasympathetic system, which regulate the body function and so forth. So this is all coming out from the spine. So if you look here, like the heart and lungs takes sympathetic, that one regulates the body, from T4, the vertebra, dorsal vertebrae number 4. What happened if you sit like this all night long reading your mobile or iPad? What happened to D4? It's going to be compressed. That creates bad impulses to the heart and lung. And that's very common. Okay, that's part of the autonomic nervous system I was trying to talk about earlier. And here is a simple example, the effect on the bronchi, the bronchial system. If the sympathetic from the spine works or become activated, it creates dilated bronchioles. Dilated, it open up. But what about the parasympathetic becomes in charge? It will go constriction. Heart, in the parasympathetic, slow down. In sympathetic, speed up. Digestion, decrease, increase, and so forth. So this is one of the most amazing structure God created us with. It makes you totally automated. The body self-heals, self-repairs, self-adjusts. Good part of it, hormonal system and autonomic nervous system. Without the quiet balance between sympathetic and parasympathetic, we are messed up. What about, it's a question here, where the sympathetic system located? Exactly in front of the spine and the head of the ribs. So any dysfunction in the spine will affect the ganglia or the sympathetic system where it affects something else. This is little, it's not important, but this is like the only exception in the nervous system, sympathetic nervous system in the human body. This goes from the upper dorsal, like the sympathetic system located between T1, like the first dorsal spine, and until L2. What about the head and neck? That's exception. It goes up. T1 to T4 gives 3 ganglia to the head and neck. And guess what? People with whiplash injury, you know what whiplash is. Somebody is in the car wearing the seat belt and either get rear-ended or hit something in the front. What happens? Their head goes like this, all the way up, all the way forward, then goes back again. A lot of mechanical disturbance happened, but look at this part. If this is at we have 3 ganglia, this is like a ganglia in medicine means like electric station, like transformer, like a station where the impulses or comes from the brain through the spinal cord to the organ, and from the organ goes through a processing center. Let's call it processing center. Okay, so if somebody get a whiplash at a higher level, like C2 or C3 or 1, he will most likely will hit the superior ganglia. Okay, look at this. If the superior ganglia get affected, it gives internal carotid artery. You see what I'm talking about? So the patient comes with post-whiplash injury, but their problem in the heart, their problem in the blood pressure. It can affect the trachea. It can affect the heart, middle cardiac branch. It can affect eyes. It can affect your vision. It can affect your back. It depends. It's not about the whiplash. What the whiplash as a mechanical force affected which part in your body. That's why there is no in osteopathy something called treatment for whiplash. There is no such thing. You have to know where it comes from. Mechanical. This is the sacrum and this is the spine. And anything happen with the sacrum, it affects the whole body. It's going to affect the pelvis, it's going to affect the spine. Because nobody, if the sacrum get twisted like this, we cannot walk like this, right? Our lumbar spine will adapt, then the dorsal will adapt a little bit, then the cervical, because at the end of the day, our eyes need to be even so we can see. You don't see people like this. right? Because if you walk like this, you cannot see. We see, but we don't understand what we are seeing. Well, guess what? Most of radiologists, for example, do not think that the sacrum does move much. So it's not an area of interest. Osteopathy, we look at this very in depth. We have what's called pathophysiology, or when the physiology is no longer functional. I don't know. Think of, I'm not sure if you see this picture. This is a picture of a uterus. I'm not sure if you can see it. And this is, no, next one. Okay, let's go back here. Imagine the uterus here is having several adhesion or scars from the C-section. How is this going to affect the mechanic of the pelvis? You see where I'm coming from? So think of muscles like quadratus lumborum, psoas muscle, and iliacus here. What's located here? Can anybody imagine what actually here lies here in this place? The kidney. Okay, think of this. Every single time we take a deep breath, kidneys migrate 2 to 3 centimeters down. Where it migrates? On the psoas. Think of somebody have a little inflammation in the kidney due to is not drinking enough water, or have a stone, or have some kind of function. What's going to happen to that muscle? It's going to get irritated and spasm. Well, we're coming closer. How this patient, imagine this patient, how this patient looks like. Unable to walk. So he will come to you as a purely musculoskeletal dysfunction, while it's not totally musculoskeletal. It's actually musculoskeletal is secondary to the problem with something else, like kidney. This is, I'm not sure if you can see this or not, this is the lung with a little scar or adhesions. This is, remember the fascia? Okay, in medicine, we don't have solution for those patients. If they have pleuritis or severe or like adhesion within the pleural system, like, I don't know if you ever seen patient having pleuritis, pleural inflammation or pleural effusion. Patient cannot even breathe because they cannot take a deep breath. Because when they take a deep breath, it creates friction between the layer of pleura. If we leave them alone, they will be in deep trouble, and actually will be totally dysfunctional very shortly after that. Okay, when we treat spine, we need to look at the vascular system. This is a superior view for the pelvis. So imagine big arteries like this, big vein like that, a lot of nerves in this area becomes twisted when we fall. If you fall on your hip, your pelvis will be twisted, and that content of the pelvis will be twisted as well. Our body have the ability to adapt, but not for how long. It depends. It can adapt. It depends on the injury, it depends on our age, our ability, our flexibility, our activity, and so forth. So I need you to think always of a structure inside the structure. Okay. This is adhesion, lecture like this, but this is a structural adhesion. Like this, no longer, we cannot help this in osteo. This needs surgery. But we have a nice statement in osteo. We say every single inch square of adhesion equal 1,000 pounds of pressure. Think of the bladder. Think of a uterus after cesarean section. Okay, this can be that structural, the surgery, or can be that simple adhesion that can be treated within actually one visit. Another thing we don't see in the back or with back pain, that the large intestine or the colon is actually attached to the back. What happens if somebody having constipation or they're having what's called megacolon, like their colon becomes enlarged and heavy? Where this weight gonna go? It's gonna go on the spine. So when they come to you, they are not gonna tell you that I have irritable bowel or I have a colon problem. They have a low back pain or back pain. So you have to figure out why they have that back pain. This is the psoas but this is actually one, okay. Another thing we don't really pay attention to, everybody in the medical fields what is called referred pain. But guess what? I have seen patients and doctors and all kind of medical field treats pain, for example, in this area and this area, with injection medication, and this is actually referred pain from the heart. You see what I mean? So we have to look at this too. Is osteopathy an evidence-based model? Yes, it is. This is not the time to talk about evidence-based, but it is very important to know this is like evidence-based, like it's been tried before. Okay, one interesting research happened actually March 2013. They are talking about the effect of osteopathy for hospital patients, like patients who go for surgery. They found they divided the patients. Some give them osteopathic treatment, some do not give them anything. And they looked at their post-operative length of stay, how long they stayed in the hospital for recovery, and time to flatus, how fast the passed gases. The one took or have experience with osteopathic manual treatment, they were able to pass gases in about 3 days versus the other about 5 days. And length of stay, one received osteopathy stays 6 days average, the other one stays almost 11 days. This means cost effectiveness. When you are able to utilize the hospital for double of the patient, that you are saving money. And this is how it works in America. And we have a lot of research. Is not the time or place to discuss it, but just want to show you. Andrew Tiller still believes that musculoskeletal system is an integral part of the total body, and the alteration within the musculoskeletal system will affect total body's health and the ability of body to recover from injury and disease. So we have the problem and the solution. I have a dream as a Hesham Khalil, like I wish to see osteopathy as a recognized profession here in Egypt. So if we can integrate the osteopathic medicine like everywhere else in the world into the medical model, that will be a good thing to dream about. Traditional medicine, Western medicine, physiotherapy are great profession. It works well in most of the cases and well organized. There are specialty and subspecialty, so we can be treated even in a most fine thing. Multidisciplinary, coordinated model, but it misses a lot of patients in between the specialties. Like you get a lot of patients with, they come with back pain, but their problem is gynecological. So those patients keep moving in between physicians. That's one disadvantage with this. And it's like having a nice race car. Osteopathy is a great profession. It's not a replacement for any specialty. It's global, help a lot of those patients cannot be treated with a traditional medicine. So it's not a competition. Let me give you an example. Last August, we had a nice conference for orthopedic surgeon in Egypt, and one of the surgeons said, what osteopathy can do, I cannot do as a surgeon. And I gave him one simple example. I live in Sheikh Zayed, where you see a lot of neighbor walking with their dogs. Okay, one of my neighbor, one day she was walking with a dog where she met another dog with another, like, not street dog, other neighbor's dog, but kind of wild. So they get in a fight. When that started, the dog pulled her totally, like she was like pulled that way. She had neck pain, thank you. She had neck pain, numbness in her hand, swelling in her hand, and she got actually realized that she had a palpitation later on. She went to every single doctor in Egypt. She went through like 17 doctors. Nothing appeared, an MRI, CT, X-ray, nothing. And nobody could treat her. We treated her in the first visit. How we treated her? We put her back. You see how simple it is? So there is a lot of patients cannot be treated or missed through the medical model, and it costs a lot of money. Imagine yourself going through 17 doctors. The agony, the pain, the medication. I'm not saying osteopathy treats everything, but osteopathy fills the gap in medicine. Medicine have a lot of gaps. Osteopathy is the best for us. So, osteopathy plus multidisciplinary medical model, efficient healthcare system. Winning formula, teamwork, osteopathy, multidisciplinary model, logistic and rules to regulate equal better healthcare system for the benefit of the patient, cost effectiveness for the government, better use of country resources leads to better development rate, better human. That's usually our goal, better human. There is a guy, leader, African-American leader, his name is Martin Luther King. He says, have a major famous one, if you cannot fly, then run. If you cannot run, then walk. If you cannot walk, then crawl. But whatever you do, you have to keep moving forward. That's what we wish to do. 3 things can change our lives: dreams, suffering, and love. I think we have to have those to change. Thank you for listening.